All right. Welcome, everyone, and thank you for joining. If you're late to the party and you're watching the recording in your car or on a walk, welcome to you as well. Today, we're tackling one of healthcare's simplest yet most expensive administrative problems, and that is eligibility verification. Across healthcare, 12% of claims get denied, and that's the highest ever rate in US healthcare history. It's a major problem. And out of all those denials, one fourth, 24%, specifically come from eligibility and registration errors. So let's unpack why this is happening, how agentic automation is changing it, and what ROI really looks like when you fix eligibility end to end. So let's introduce Rano. So I'm joined here by Rano. He's actually been helping healthcare orgs automate front end, middle, and back end workflows across revenue cycle, across patient intake, all the way from eligibility to prior auth to denials for a long time. Any words, Rano? Thank you for coming.
No, I mean, first of all, thanks to the audience who have joined us today. And it's an exciting topic. It's a topic where the timing cannot be any better because as of now, we have been working with quite a few clients, but it seems like one of the first AI projects where healthcare providers are very interested and keen on to automate is in fact eligibility verification process. So yeah, I'm very excited once again to give a quick introduction about myself. Like Gabe said, uh, my name is Rano Banerjee. I am the Associate Director of Healthcare Automation Solutions at OpenBots. I do have a front-facing role when it comes to working with the clients directly, understanding their pain points when it comes to optimizing the revenue cycle operations, and yeah, finally giving them solutions according to the tools that we have in our bucket. Yeah, excited to talk about some of the use cases that we have already implemented for our clients when it comes to eligibility and verification benefits, and I'm very much looking forward to this session.
Thank you, Ronald. My name is Gabriel Skelton. I am the head of sales here at OpenBots. We will be doing something different today. So I will be the host to start, and then Ronald, you'll jump in my seat in the second half, and you'll be the host and you'll run things. So let's actually
Yeah.
get started. So Ronald, just to begin, why does eligibility remain such a major cause of denials, even though every clearinghouse, every tech vendor claims to handle it? To unpack that a bit for us, if you don't mind.
Yeah, great question to start with. And we often get this question when we talk to our prospects in the intro calls or in the initial level of discussions. Like OpenBots, I do have a EHR that is integrated with a clearinghouse. So, what's the need for me to even have an AI agent to do eligibility verification? I think it all comes down to two or three things. It comes down to flexibility, accuracy, and the adaptability of AI agents. And I'm going to unpack the reasons why I mentioned these 3 points. First of all, AI agents is going to work in real time with payer systems. So you have a patient, and the patient might have the insurance coverage which is missing, or the patient can have a discrepancy in their insurance related information. When you have AI agents, you have a handle on getting this information real time. And you can side by side compare this with the clearing houses that you have been depending on for a very long time. But clearing houses are great, but the type of coverage that you're going to get from the clearing houses is going to be more static in nature. It's not going to be dynamic enough where you would get to see the details of every single insurance plan. And as we all know, when you talk about insurance companies, their guidelines and their requirements is constantly getting updated. So that's why there's a preference for healthcare organizations to use AI agents instead of using the clearinghouse that is already available for eligibility and verification benefits. Now, this is the first part, Gabe. Let me focus on the second part, which is the essential part as well. When you talk about clearinghouses, their coverage is not 100%. And what do I mean by that? A clearinghouse will definitely have an integration with the big commercial payer, like a United Healthcare or a Aetna. or a human. But me as a healthcare practice, if I put myself in the shoes of a healthcare practice, I can have patients whose secondary coverage is on some state specific insurance plans. And what would I do in that particular situation? It's my insurance team member who, once again, has to do the work of going into the state specific insurance web based portal and then trying to run the eligibility check manually and then populate that record back into the EMR. That's the thing I would do, regardless or despite having the clearinghouse integration done already. And this is one of the main reasons why AI agents are very flexible. They can adapt to the situation. They can understand that for this particular specific health plan, I need to go into this particular payer portal, run the eligibility check, and then once again convey that record back to the EMR. And I think it all boils down to these factors why we have been talking to many C-suite executives lately from many different health practices, and they're trying to lean more towards AI agent instead of depending on the traditional clearinghouses for insurance eligibility.
Yeah. So what I'm hearing is that it being real time significantly matters. And right now, the solutions that exist are very surface level. For example, if you have a state specific payer portal that has a lot of volumes for you, that's tougher to have an existing integration where having automation really helps you because it gives you much more flexibility here. So that ties in perfectly because you can look and say, hey, 24% of denials are caused by eligibility. That's awesome.
Right.
Let's get deeper. Like, what are the actual root causes of these denials? Like, great, they're attributed to eligibility, but under the hood, what's really happening?
Yeah, I mean, let's talk about a simple stat. I was reading the stat that 1 out of 5 claims on first submission is getting denied. And now, if you just try to focus on eligibility, that is going to account for 20% of those denials. So obviously, there are a lot of factors that is leading to these denials. One of the first things we see is a small mistake, but that mistake can be, having a big payoff, which is an inaccurate entry of date of birth of a patient. A very small thing, but if you are, inaccurate when it comes to entering the data of the patient's date of birth, then at the end of the day, you are going to get that claim denied. Now, think about the steps from there. You talk about coordination of benefits, for example. A patient can have one primary, one secondary, one tertiary, and even more list of insurances. That's on the patient's will. Now, when you are doing the coordination of benefits, you have to make sure that you are adding the information of the insurances in the right way. You're not listing it in your own will. You have to make sure that everything is gathered in the best possible way. But I think it also comes down to the fact that healthcare providers in general, their main focus is to treat and serve patients. And some of the groups that we work with have huge amount of patients to deal with on a daily basis. So there are chances that they're not able to cope up with the insurance eligibility coverage for every single patient. And here's why don't I do this, Gabe? Why don't we share with the flow diagram one of the recent projects that we have done for one of the largest Missouri-based behavioral health centers. They are perhaps turning out to be one of the largest non-profit behavioral health centers across the states. And we actually have helped them in insurance eligibility and guarantor addition piece. So here's what we have done. So let me share my screen, Gabe, and let me just show it to the audience on a little bit more vivid view, exactly what we have done for this group. Okay, I'm hoping my screen is visible. So this is what we have done for this Missouri-based healthcare group. So, I mean, the problem for them was a big one. I mean, the fact that this is such a big health center and they are catering to almost like 500 to 600 patients per day was the main root cause for the problem. Now, the problem eventually transpired to a denial, but what has happened is that they had a team of roughly 10 people who is responsible for making sure that the insurances of all the patients are added in the right way. But more importantly, it's added in almost real-time updation. Now, it's impossible, for a big health system, you cannot cope up with these volumes every single day. What we did as OpenBots is that we actually used our AI agents to access their own system and find the list of guarantors. I'll explain what guarantors is. Guarantors in the term of healthcare addresses all the insurance companies and the self-pay a patient is allotted to. For example, if I'm a patient, I am patient A, and I have the primary insurance as United Healthcare, the secondary insurance as Medicare replacement plan, and the third insurance as perhaps Aetna, and then I have a fourth one which is self-pay. Then all four of these insurance coverages are for guarantors that I have. Now, for this healthcare group, the AI agent that we built, it was mainly able to do two things. The first thing was trying to make sure that for every single patient, regardless of the patient having four guarantors or six guarantors, we should always see that the insurance guarantors have a previous effective insurance start date, but more importantly, a future the insurance coverage end date. Meaning, a patient might have four different guarantors, but who knows if one of the four guarantors or one of the four insurances has already lapsed 30 days back. Now, they were not able to cope up with this problem because, 550 patients, and think about one patient even having three guarantors. You have to review more than 1650 records to review the information. The algorithm that we built was able to organize all the guarantors of the patients in the right way. It was able to review whether the expiry date has already is coming closer or not, or whether it has already been lapsed. And depending on that, we were taking that list of data, going into NetSmart My Avatar. NetSmart is the EMR at play here. And we were making sure that we were opening every single patient's chart by giving the patient's ID number and adding the guarantors in the right priority order. And the process might make it look simple. I would say it is simple, but it's very difficult to cope up with the volumes, which is number one. And number two is, if you are not adding the guarantors in the right way and you are not updating the records in real time, then this healthcare group was already providing the services to the patients. But when it comes to billing the insurance company, they were actually billing the wrong insurance companies. They were sometimes billing insurance companies where the guarantor's insurance coverage has already lapsed with the patient. And eventually they had to write off that entire claim. So they are not getting the money for which the services was already provided. So this was one big project. I think we have been able to make sure that we are not just preventing the denials, but more importantly, streamline the workflow so that the insurance people can right now focus on tasks, which is much more strategic instead of doing this data entry work within the end system of records.
I love that, Ronald. What I'm hearing is that it could be something as simple as the date of service being incorrect, right? And in this case, the root cause was billing the wrong insurance company. You got to be careful.
Correct.
At times you can actually automate a process, and if the data is incorrect or it's automated in a way that's being handled that's incorrect, now you just made a bigger problem. But the root cause is awesome, whether it's NetSmart or any other EHR, or it's a state-specific payer portal or a commercial payer or a government payer. What matters is making sure you have the root cause of the problems that's causing the denials. You don't take over just the time savings, but you actually affect the bottom line. And here it's fascinating because if you look at it statistically, out of all the root causes of eligibility errors, number one is coordination of benefits. That's like half of all of eligibility errors stem from that. So if you look at it, you might say, oh, hold on, that might be where your problem is. In this case, that wasn't the case. It was a major problem causing denials, not related to COB. It was actually related specifically to looking at billing the wrong insurance coverage and making sure the coverage lapses were correct. and how
Correct.
do I get there? So the benefit too is that it's very flexible. For example, if there are coverage lapses, you can have the bot run eligibility not just at scheduling. You can do it at the day of service. You can do it 7 days before. You can account for any possible plan change that is very difficult to do when you're doing a process manually because you're just surviving. You're just trying to get things through the door. But when you have automation, you can add a lot of ancillary pieces to the process to once again figure out what the errors are that are reducing denials and mitigate those errors.
Exactly. And give those are excellent points. One of the things that's often not highlighted is that if the insurance team member is not spending so much time on doing this data entry work and making sure that the insurance verification coverage is right or wrong, that particular person can spend more time talking to the patient and understanding whether the patient wants to renew the contract with the insurance policy or not, and taking some decisions on things which, till as of today, a human is better at doing it instead of AI. So it's how you are looking at AI, not to downsize the team, but rather reallocate your staff on more appropriate ways to do more strategic things, I would say.
Yeah, absolutely. So, in line with that, Ronald, everyone loves to use and drop the term agentic AI, agentic automation. We even put it in the title of this
Right.
webinar to get some demand, right? But is a legitimate factor to automate the process in the most substantive way possible. Tell us a little more about how does agentic automation actually work and even apply to this?
Yeah, obviously, this term agentic AI is a hot term right now. It's getting applied everywhere, regardless of whether it's traditional automation or it's really autonomous AI solution doing it. For us, when we talk about agentic AI in terms of insurance eligibility and verification process, we do have a pure structure of making sure that our AI agent is almost doing the work of the insurance team of a healthcare provider who was currently responsible for doing it manually. So our AI agent should be able to at least cover 80% or 90% of the work that the insurance team of a healthcare group is doing. And that's where we have tried to formulate the term and give some responsibilities to our AI agents. Now, first things first, we are talking about insurance eligibility, but one of the processes that is closely aligned even before insurance eligibility is patient intake. Now, I mean, we have already discussed that sometimes even inaccurate member ID can cause a lot of problems at the back end of revenue cycle, where you typically get a denial from insurance company. So the first thing which our AI agents do is that it is going to make sure that all the information from the patient's face sheet or demographic sheet is picked up in the right way, and it is populated in the EMR as if the first thing the AI agent would do is creating the patient's chart. This is the first thing we want to ensure. We want to leave no space for those inaccurate records to pop up, because even before doing insurance eligibility, you need to make sure that the patient's first name, last name, date of birth, even the email ID, phone numbers, everything is correct. So that's the first thing that our AI agents do, which is literally translating the data from those faxes or translating the data from those face sheets and converting it into a patient's chart. That would also include the name of the primary or secondary medical payer. What's the next thing? The next thing is, how can we make sure that the AI agents can go into the payer portals or access the payer portals? We are talking about the Avelities of the world or the United Healthcare or the Evercore. But how can our AI agents access these portals, run the eligibility check with member ID and date of birth, and then make sure that the patient has active coverage or not? But just checking active coverage is not the only thing we do. That's the first thing of many that we would do. We would first try to have the AI agent check whether the patient has active coverage. The next thing for the AI agent would be to see whether the patient's name and date of birth is represented correctly on the payer portal. Then you have to check whether the patient is on a specific health plan which you expect the patient to have on the payer portal. And finally, you also need to see whether the insurance effective start date and expiry date is having a past and future date, respectively. So you need to see a lot of things first, you need to validate that. But the next particular step is going to be another time consuming step, which is you have collected all the patient insurance records. Now it's the AI agent who is going to come either into your practice management system or into your billing system and create the insurance information altogether. Now think about this, Gabe. The process that I just explained to you, it's for one insurance. Roughly takes 2 to 3 minutes for a person to do. What if the patient had a secondary and a tertiary insurance based on the coordination of benefits? In that case, you have to triple this amount of time, which is 6 minutes, simply to add the insurance information of the patient and attach the record on the patient's chart. So there's a lot of time that we have been saving for different clients who has opted to automate this particular process with OpenBots.
Absolutely. So what I'm hearing is the importance of, like, if you're going to automate this, begin with the highest volumes as well. Is it on Evicor? Is it on One Health Corp? Is it on Availity? Typically, you want to start with aggregators that touch many payers. If not, go with a state-specific payer, whatever you feel like has a lot of value. I mean, a lot of volumes. But that's a really good breakdown, because to your point, if you're doing it manually and there's multiple insurances, you have to check every single one. And that's a waste of time, because it can simply be automated. And then if there's an exception, then you loop someone in. Last question for you, Ronald, before we actually turn the tables a bit. But for you, I mean, what have you seen? What are the main results that healthcare orgs are seeing after automating eligibility?
That's a very interesting question. Well, we are seeing practical live results, and I'm going to take one live customer success story that we have. Or why don't we talk about the same diagram that I was showing a few minutes back? So this Missouri-based healthcare group that we are talking about, they immediately saw an impact of at least 4 FTEs saved based on this automation. And I'll explain you why it is turning out to be 4 FTEs. So for every single insurance guarantor that this group was adding, it was taking them 3 minutes. And on a regular basis, they found they have close to 550 guarantors that are getting added. So if you simply multiply 550 guarantors with 3 minutes, you come to a point where you are saving close to 600 plus hours, which is almost like the work of 4 FTEs. And like you touched on in the initial part of the call, Gabe, it's not just about the time savings, it's also about the denial prevention. The fact that this group had a bigger problem to solve, which is not billing the companies or the insurance companies where the insurance has already lapsed for the patient, was a major problem. Right now, we are trying to proactively help this group to get rid of this problem. We are making sure that they are not billing any particular insurance company where the patient's insurance information has already lapsed. So there has been some significant benefits, particularly for this group. And as we speak, I think we should be in a good spot to even save more FTEs for the same project as their volume goes up from 550 guarantors a day to 650 guarantors a day. So yeah, there's a lot of time savings. There's a lot of benefits when it comes to denial prevention when you are picking up projects like this.
Absolutely. All right, Ronald, let's turn the tables. Go ahead.
Yes. So I think we have quite a few questions for you, and the audience wants to hear some questions from you. And give, we know we have a different role in the organization. Sometimes you do consulting, sometimes I do consulting. So there are quite a few questions I have. But let's start with the first one, Gabe. let's start with the first question, which is, according to you, why do you think, you know, insurance eligibility is such a big problem that you often hear the C-level executives and the big decision makers coming to you and telling you, I want to lean more towards eligibility as the first project and not prior auth and not payment posting. Like, why are people more focused on eligibility to start with?
Yeah. I mean, if you're a healthcare executive and you want to bring in a technology project, you can love it all you want. You can't convince your fellow colleagues, you're not going to get anywhere. So the reason specifically eligibility is that it's the easiest to automate and the hardest to ignore. It's literally the path of least resistance when it comes to automating something within patient intake and revenue cycle that's simple and has the results. Now, the main goal of every single chief financial officer and every single chief revenue officer and every single chief revenue cycle officer is fewer denials and ultimately higher reimbursement. That's the goal. So really you need ROI. ROI is everything here. And there's two specific pieces to the ROI, which we already mentioned is time savings, awesome. And the big one is denial reduction. So numbers talk. We already broke down 12% average denial rate in healthcare, 24% from eligibility errors. Therefore, it's just about 3% of total denials stem from eligibility. Dive a little bit deeper. Out of those 3% of denials stemming from eligibility, half of that is specifically from coordination of benefit issues, like you mentioned, whether it's accidentally billing the secondary insurance or not knowing primary, secondary, tertiary. Half of that, that's 1.5%. Think about the money. So think about a healthcare provider that's small, that has like $100 million in revenue, right?
Right.
1.5% of that is $1.5 million down the drain just because of manual errors and not having enough of technology to support people in handling
Right.
the existing volumes they have. So even just figuring out why insurance, like which insurance should pay first, is a huge thing. And like you said, it's agnostic. So when it comes to agentic automation, it's agnostic to the systems needed to process eligibility, whether it's a payer portal or an EHR or any other system. This kind of technology can handle and take over that manual work, even when there is reasoning necessary. So it's in foundationally out of everything, right? You might have situations where an auth is not needed, like a prior auth, but eligibility is basically needed by every single kind of healthcare provider for every single non-self-pay patient. So it doesn't matter if you're substance abuse, behavioral health, cardiology, gastroenterology, dermatology, oncology, radiology, ortho, you name it, you need to automate this. And the process only changes so much. And even if it does change, it tends to be simpler than a lot of other things you can automate. So foundationally, eligibility is like the backbone of your revenue cycle, and automation ensures you can have every single covered patient encounter and get reimbursement for it. And like you said,
Right.
happen in real time.
I mean, great points. I absolutely second you on some of the things you mentioned when it comes to ROI. But the ROI is there. It's just a question of trying to analyze the process initially and understand the expected ROI, because we as AI vendors, we have seen that the ROI is there, and sometimes there is a net positive ROI starting from month 4 or month 5. So yeah, I mean, I really like the answers you mentioned, but Gabe, that kind of moves me towards the next question that I have for you. Um, what's the best way to have internal buy-in for these kind of automation projects? One highlight, or rather one stat that I want to tell you, is that we often speak with many different executives, and some of the times they tell us that OpenBots, we are interested in what we do. But having said that, one of the recent surveys of Harvard Business Study highlights that 90% of the AI projects is not delivering tangible benefits to the clients. So, Gib, my question to you is once again, what's the best way to build internal buy-in, And if I had to tell you, Gabe, challenge the stat that I expressed from HBR, how are you going to challenge that notion?
I love that. I love that. That's an awesome stat, and it is true. Now, the main difference, and again, we have some Q&A we'll get to at the end of this, but the main difference is generic AI versus industry-specific solutions. I mean, we've all used all the large language models right now. That's generally using AI. You can call that using AI. But foundationally, when you have subject matter expertise and you're working as specifically as possible, that tends to have a lot more success. And of course, if you're working with the technology partner, talk to their happy clients, right? It's hard to fake that. Talk to their happy clients and see how they're doing and what the challenges were and what did go well. No technology is perfect, but what matters is hunger to get the solution ready and adding value. So the way to approach that, because again, we all talk about the benefits of automation, but we don't and talk about enough. How do you support a healthcare exec to actually get internal buy-in? So foundationally, number one, set your success criteria. Like if you're a CFO, what are you looking to accomplish? Are you looking to save, I don't know, 500 hours a month and a few FTEs of work? Are you trying to figure out where your denials are even coming from within eligibility? Are you looking to reduce your denial rate? Are you looking to, you know what, I want to automate at least 75% of the process and then I'm happy? Are you looking to stop doing it in a batch way and doing it real time? Like, what is that goal? Are you looking to reduce the denial rate to under 1% or something of a very big goal like that? That's what you have to start at. Number two, then focus on scope. So make your life easy, right? There's going to be hundreds of payer portals that your staff is working on this saying, hey, we have this. Focus on one payer portal to begin with. Make it a super simple pilot. Automate that. Focus on like a One Health port, an Availity, an Evicor, some kind of aggregator that's already aggregating multiple payers. That's going to help you have the most volume possible in your pilot, because sometimes it could be anywhere from 30 to 80% on one specific payer aggregator. That's a lot of volume to have with one simple, fast automation. And after that, I mean, look, what we've seen with our clients is that if you're like a healthcare subject matter expert and you're newer to automation and you get one in production and you see this thing working, it almost like for every other function in every other department, the desire for automation spreads like a disease, a good disease.
Exactly.
Everybody wants it because like, oh wow, this thing works. It's not just buzzwords. So I love that. And then the other thing is champions. So you got to have as many champions. You can never have enough champions because you have to have operations on board. You have to have your rev cycle teams on board. You have to have intake on board. You have to have your finance team on board. You have to have the board approval on board. So you literally need an army of champions because you won't get everyone, but if you can get the majority, you will have a higher success rate of approval because it cannot be just on you. It can't be just on the CFO or the COO or the CEO or the CEO. It has to be a group effort. I mean, think about it. We always talk about it. Like I have 3 kids. If one of my children asks me for something, I might give it to them. If all 3 of my children and my wife ask me, super high rate of approval, right then and there. So the getting as many champions as possible is so important. And the last thing I'll say is the number one reason why folks don't start with automation is 9 times out of 10 it's inaction. It's not, it's getting into analysis paralysis. There's this vendor, that vendor. It's 9 times out of 10 either you go with the technology partner and you're going to go with, or you just do nothing. But what is the cost of inaction, right? Things are generally being processed. The world is not ending. You're generally processing. Your rev cycle teams are working. But if you're handling things fully manually, you're putting so much manual dependence on folks that are taking on so much volumes where you're probably also growing, and that those individuals are expected to take on more without having more employees. You can keep hiring more people and adding more people to solve the problem, or you can have technology take over all of the rudimentary pieces, free those folks up who are subject matter experts. They're smart individuals with a lot of experience to focus even deeper on AR follow-up, but they're focused even deeper on how can we actually, resolve denials at a higher clip or spend more time calling payers and things of that nature that are harder to automate.
Right. I mean, I absolutely love some of the points you mentioned, Gabe. It is actually in line with what we hear from our prospects. Start small, start from a point where you are not automating every single thing on day one. You might start with one pair portal, like Verity that you mentioned. Yeah, it's an excellent way to move into the pilot phase, and then you can expand the things, right? I mean, you can always automate the same work on top of five pair portals. So that's absolutely right. And the final point that you made on the cost of inaction, I 100% agree with this. I think I read this stat, and there's a couple of stats that I read through, which is it literally takes $5 or more for every single insurance person to still manually process eligibility benefits. So it still cost of $5 for every single one of these transactions. So think about a practice doing thousands of those. And the other thing which I can also share with the audience today is that it's okay to spend some money on the front end rather than paying a heavy amount of money on the back end. What do I mean by that? I mean, if you are still doing the eligibility and the prior authorization process manually and you're getting a lot of denials, then you're reacting to that particular denials, like you're not proactively preventing it. And the stat that I read is that it takes $118 for every single denial to be reworked upon. So if you want to appeal every single denial, you have to pay $118 for every single one of those. And the number adds up very fast. So once again, I fully align with the answers that you gave, particularly on the areas of cost to inaction and choosing maybe one single portal to do the pilot. Gib, I do have a very important last question for you, which is, you often have the role to give some confidence to the organizations you work with by saying like, okay, yeah, OpenBots, we are the vendor who is going to handle eligibility. Uh, but at the same time, one of the questions which I have heard you got is, where can we get some quick wins and build the momentum? Like, even if I have to take only insurance eligibility per se and nothing else, within insurance eligibility, what would be the easiest place to start where I can get a quick win, and then I can leapfrog from there to expand the sources and optimize the process full-fledgedly? If I had to ask you this question, where would you start, Keith?
Great question. At times, Ron, I feel like we're like guilting folks. It's like, if you don't automate, you don't respect your people. But in reality, I mean, the reality is like, if you really
Sometimes we
want
do.
to support your people best, it obviously technology really helps, especially automation technology is booming right now in the healthcare space because it's a logical next step, especially for so many healthcare providers. But what we hear all the time is, I want to automate everything. I want to automate everything, but start simple, like you said, and look at what is the cost of an action versus, if this project goes terribly wrong, what's the cost of that? 9 times out of 10, it actually outweighs and say, you know what, we can get $150,000 of returns, up to $3 million of returns if it goes well, versus just doing
Right.
nothing, keeping things as they've always been. So step one, map your current process. We've seen so many times that even if a healthcare provider has SOPs, they're either stale
Mhm.
or they don't have every detail necessary. The information is in the brains of the subject matter experts at these organizations. And it helps a
Yes.
lot just to at times get a third party to ask the right questions to pull that information out of the brains of subject matter experts and put it on paper, present it to them and say, hey, is this what's in your brain of how the process works? No, change this and that until we fully agree and say, yes, this is exactly at a high level how the process works, and here are the moving parts that we do. Once you do that, now you can actually get to the root cause and target the big problems, whether it's the coordination of benefits, which is 50% of the reasons for denial, whether it's the benefit maximums, which is 27%, whether it's the plan coverage issues, which is about 17%. So we have the data behind what it typically is, but when we map it out, we can see with a clear kind of bird's eye view of where the issues lie. Then when you want to automate, I mean, then you're moving from, if you're moving from batch to real time, like just that is just a phenomenal difference in terms of how this is being processed, even for the patient experience, aside from bottom line. And lastly, when you're automating something like eligibility to start, or even accounts receivable follow-up or something like that to start, that's the foundation. Then you can get into prior auth if it's relevant to your org, or you can get into, hey, you know what? We
Right.
also have this issue of we get all of these faxes and we have 4 folks over there just sifting through every single fax, or hey, we have all these folks looking at all the incoming referrals that are coming in, or we're a PCP and we actually have all these people manually sending out all these referrals, and we don't have a clear arms kind of wrapped around our current referral closure rate, right? You know what? Payment posting is a challenge for us. Or hey, you know what? We want to help with automation with the top reasons for denials that show up on that ERA and that EOB. These are the kind of things that you can start thinking about in solving even more complex problems. Once you solve the simple problem, you have that under your belt, and now you have the trust of not only healthcare executives, but everyone in the org, and you now can move. You can, almost like trailblaze through of everywhere you can automate and completely change the way your org runs, and you start attracting more talent and keeping more talent, because now folks are not doing rudimentary work, they're doing thought-provoking work, and you're exercising their talents as best as possible.
Excellent answer to this question. What I heard from you is start small, and even if you have to pick up insurance eligibility, maybe start with the coordination of benefits piece, or start with the insurance eligibility expiry date or termination date piece, and make sure you can prove it out and give some immediate benefits to the healthcare group. And then you always have a chance to scale from there and pick up more and more problems which you can solve. Absolutely, that's a good way to put it up, I would say, Gabe. And I would say those were some of the questions that I had for you. In fact, Gabe, I had spent a lovely time doing the exact thing that you do, which is kind of hosting and moderating the webinar. So yeah, enjoyed this part. But nevertheless, I think you mentioned we have a few questions in the chat that popped up. So if there's time left, we can definitely address some of those.
Let's look at that quickly. Okay, so Ronald, this will be a question for you. So the question from Hayde Hayat is, while your AI agent finds the insurance is lapsed, is it trained to discover what insurance the patient currently has? Sometimes patients themselves are not aware of their current insurance, especially when they are a Medicaid beneficiary.
That's an excellent question. This brings me to the point of Medicare replacement plans. Patients are walking into the clinics with a Medicare insurance card. They don't know what the replacement plan is, and nor do the organizations who is going to give them the treatment knows what the replacement plan is. And Gabe, before answering this question, all the procedure-based organizations, they would find a patient like this with a Medicare ID. They're going to do the procedure for them. And later on, they will realize that once they have billed the claim, it's coming as a denial because of the main reason that for Medicare replacement, you need authorizations for the procedures that you're performing. Even you need authorizations for the office visits. So, once again, it boils back to the same point, why insurance eligibility and data gathering about the insurance information of every single patient is important. Coming to this question, is OpenBots trained to discover what the insurance currently the patient has? We try to tackle this problem in one or two different ways. So OpenBots is not a repository of all the patient's insurance information that is publicly available. We are not a repository of it. What OpenBots is actually automating the processes on top of the payer portals and the EMRs and EN systems. So if the healthcare provider tells us that OpenBots team, if you have seen that the patient has got the insurance lapsed on United Healthcare, then why don't you try out the next 3 payer portals and see whether the patient is going to be covered in those 3 payer portals or not? We can absolutely run the insurance eligibility check for the next 3 payer portals where there's a probability that the patient will have one of those insurances. And if we get the coverage, we take that record, we bring it back to the EMR, and we put it there. That's the way we solve this problem. Having said that, the question is very interesting. If we come to a point where we are not getting the insurance coverage of the patient on those three portals, we either move it into an exception queue, or we rather have someone from the healthcare office talk to the patient and ask on a phone call which insurance has this patient tried to take up as the new replacement plan. We help those kind of insurance team members by doing their data entry work or the dirty work, and try to give them all the time they need so that they can have this patient discussion happening on the phone call. So that's the way we tackle it.
I love it. I love it. So thank you for answering that, and thank you for asking the question. So let's wrap things up. I mean, I'll give, if you don't mind, a quick takeaway from my end, and you give a quick takeaway from your end, Ronald, and then I'll tell the folks how they can actually learn more about this. So from my perspective, I think what we've discussed is that it's people first. Healthcare executives valuing their people most is giving them the technology they need to best do their process, and best in class technology that every healthcare provider is currently either utilizing or aiming to utilize. When it comes to eligibility, it is the easiest process to automate and the hardest to ignore, and one of the highest impact areas, hence how it's the number one reason for denials. In passion, I mean, obviously we're very passionate about this, but it's because it affects people's lives. You might be an individual taking time off of work to actually go and get care. You might be elderly, and you get your care delayed just because there's a minor issue through no fault of your own. So this stuff really, really matters to do it correctly. Ronald, any final takeaways or words you have?
Just to wrap up, Gabe, what I would say is, our mission, once again, we reiterate our mission in every single of these webinars. Our mission is to make sure that the healthcare providers are getting paid for the services that they have already provided to the patients. And that, kind of keeps the healthcare system sticking. And every single denied claim is a missed opportunity to recoup some of the revenue. That's a real fact. We cannot deny that. I think now is the right time for any healthcare practice. It could be a small healthcare practice or it could be a large health system, to try out Agentic AI, to try out intelligent automation, and see what kind of benefits they can get in the first place. So one of the things that I would like to leave the audience with is that if you want OpenBots to just look through your eligibility workflow and vividly and candidly tell you whether even we are a great fit or not, then me and Gabriel, we are very much available, on LinkedIn, or you can even drop your comments on the chat, and we would be more than happy to, have an initial level of discussion with you and see whether we are a great fit for your particular eligibility workflow.
I love it. And we thought we were done, but we can't leave without answering Eric's question. I just put down in the chat for folks that are looking to learn more. But Eric Estrada asked, if unable to find insurance within the 3 to 4 portals, what is the turnaround time of informing clinics?
Great question, and thanks for asking this, Eric. If we are going to the 3 and 4 portals and trying to run the insurance eligibility check, then you are typically looking at max 4 minutes. We are not even thinking of taking 4 minutes. The way we do this AI integrations is either it's going to happen through API or HL7, or it's going to happen through surface automation. The time where it takes the most amount is going to be surface automation, because you're literally replicating the steps that someone in the insurance team is manually taking to run the insurance eligibility checks. So the worst case scenario is 4 minutes. The best case scenario is you will have everything done in 1 to 2 minutes, and you're going to get that either exception or right record back within your EMR.
Excellent. All right, just to wrap things up. So I think based on everything we discussed, Rado, I think the next steps you can take if you're looking at this is, look, scope pilot on a few payer portals, ideally just one payer portal, limit some of the variables, and get that pilot automation going with a technology partner, and you can impress your colleagues and then expand further from there. Establish some kind of success criteria in ROI, and like I said, a mini ROI, because you don't need to always solve world hunger to make a lot of benefits here and a lot of headway to then get to that bigger problem, set up that mini ROI and what a criteria for success would be for a pilot, and then automate. I mean, be very careful with analysis paralysis. Waste a lot of time and money. Once you have a scope, once you have minimal ROI, once you have buy-in, once you've chosen an automation partner, don't fall into analysis paralysis. Go automate, go do it, go get going, and learn a lot of lessons by doing. That's what we would say. So again, tell us your problems if you want to actually learn more about it on our website, or reach out to Ron and I directly on LinkedIn. We're extremely active on LinkedIn. And thank you everyone for the time today. And if you didn't get to ask a question, we can answer it offline for you.
Absolutely. Thank you, everyone.